Hartman offers two non-adherent wound contact layers, Atrauman and Atrauman silicone. Atrauman dressings are single-use, sterile, non-medicated ointment dressings suitable for the treatment of superficial, acute, and chronic wounds of any type. As a non-adherent wound contact layer, it is particularly suitable for preventing the secondary dressing from sticking to the wound bed and for protecting wound edges. Due to the neutral properties of the non-medicated ointment coating, Atrauman is especially suitable for patients with sensitive skin and those sensitive to certain medications. Atrauman silicone is a thin and soft wound contact layer, and it is coated with transparent silicone on both sides. It can be used as a protective layer for non-exuding wounds or with slightly to moderately exuding wounds. The porous construction is permeable to wound exudate, allowing it to be absorbed into the secondary dressing. Atrauman silicone protects organs and other sensitive structures during use with negative pressure wound therapy. Do not use Atrauman or Atrauman silicone on patients who may be allergic to any of their ingredients. Prior to dressing application, clean the wound using normal procedures and thoroughly dry the surrounding skin. Remove the dressing from the package, leaving both cover papers in place. Atrauman and Atrauman silicone can be cut to size to adapt to various wound sizes, shapes, and locations without unraveling or shredding. Once you have cut the dressing to the desired size and shape, remove one paper cover. Place this side of the dressing onto the wound and remove the second cover. A secondary dressing should be used over the Atrauman and Atrauman silicone to absorb exudate. For low levels of exudate, one potential secondary dressing is Cosmopor. Cosmopor is a sterile adhesive wound dressing that is soft and gentle to the skin. It has a fluid-repellent backing and rounded edges, which allow it to conform well to body contours while staying in place. Remove the Cosmopor from the package. Remove the first release paper from the back and apply to the skin, smoothing the edges to minimize wrinkles. Remove the second release paper and smooth the edges into place. For wounds that are dry or slightly exuding, another secondary dressing option is Hydrofilm. Hydrofilm is a sterile, transparent film dressing with an adhesive coating. It is waterproof, reduces the risk of secondary infection, features rounded corners to reduce potential roll-up and extend wear time, and is highly breathable to reduce the risk of peri-wound maceration. Hydrofilm should not be used as a primary dressing on clinically infected, bleeding, or heavily exuding wounds. Remove the hydrofilm from the package, and note the release films are labeled to simplify the application process. Remove the release film labeled number 1 and apply the dressing to the skin. Holding it in place, remove release film number 2 and smooth the dressing onto the patient. Remove backing number 3 and backing number 4. And smooth the entire dressing into place. If you have questions or would like additional information, please reach out to your Hartman USA account manager or call our customer service team at 1-800-243-2294.